Welcome to Relentless Mentality. I'm your host, Justin Bayless, and on this episode of Relentless Mentality, we have another change agent who has another amazing story to hopefully inspire the community and help you to move to action. I want to welcome Dr. Avein Saaty-Tafoya to the show today.
Relentless, commonly defined as oppressively constant, determined, showing no abatement of severity, intensity, strength, or pace. I believe relentless is an ethos. You're not stopping until you get what you want. You're not taking no for an answer. No obstacle will deter you from your goals. Relentless mentality is where we get to tap into the mindset of change agents, leaders, and icons. My hope is that their stories will inspire and motivate others to transform their mentality in their profession, their personal life, and ultimately their communities. So remember, when it's tough, will you give up or will you be relentless?
Thanks for having me here.
It's awesome having you. And one of the things, so Shane is our producer of this show, and one of the most difficult parts of this show is introducing our guests because everybody has such a amazing background, resume, and accomplishments that it's almost impossible to narrow it down within the parameters of the show. So I'm going to do my best to introduce Dr. Tafoya very, very briefly. Dr. Tafoya served as the president and CEO of Adelante Healthcare since 2006. Adelante Healthcare is a federally qualified community health center, and under her leadership has grown from a handful of clinics serving 12,000 patients a year to now over 90,000 patients in 9 fully integrated community health centers throughout Maricopa County as well as Pinal County.
70,000.
70,000, excuse me, 70,000 patients. So see, I told you, it's very difficult to get the numbers right and all the things with everybody. So she serves on the steering committee of the A.T. Still University Southwest College of Osteopathic Medicine in Arizona, board of directors of the Greater Phoenix Chamber of Commerce, and serves on the executive committee for the Value of the Sun United Way. Dr. Tafoya was awarded the 2014 Changemaker Award by the National Center for Healthcare Design and now serves on the National Center for Healthcare Design Board of Directors. She was Valley Leadership Class 30, named to the Phoenix Business Journal 40 Under 40, and 2016 Outstanding Women in Business. But if you know Dr. Tafoya, you know the most important thing to her is being an artist and being mom to her 2 boys who are both 12 and 7 years old. So I'm really excited to have you on today because I think you have a really inspirational story. And as we've talked about before, I was hoping you could share some light on kind of your background and your childhood and, you know, how you got to Arizona, and as we can kind of summarize that as much as possible because I think it's an amazing story. You really being an immigrant to this country and how you've become a CEO of such a large organization. So could you share a little bit about that?
Sure. So my family were refugees and came to the U.S. in 1977 under political asylum. Prior to that, I was born in northern Iraq in an area of Kurdistan. The Kurds are, you know, a group like the Armenians or the Jews in the Middle East. And so they, at one time, you know, had a country called Kurdistan. After World War I, it was split between 5 different countries. We spent a little time in Iraq. My parents, my dad was a math teacher and a principal. My mother taught English. We went from Iraq to Iran. They taught at an American school there. And so the year we spent in Iran was quite progressive, very Western. But then, you know, there was some breakdown, and we left there before the assassination of the Shah. If you've ever seen the movie Argo, that's kind of my, you know, my childhood story. Wow. We went from Iran to Germany as a sort of pit stop in that transition to the U.S. And I ended up growing up in southeastern Ohio in a small rural Appalachian community. So it's really a full circle of experience because, you know, growing up in that small rural community was my first introduction to poverty at that level. Even having been in refugee camps, what I saw in Appalachia really eclipsed my own, you know, immigrant experience.
Wow. So just to kind of summarize that, so at 6 years old, a Kurdish immigrant family moves to Middle America, rural America in Logan, Ohio.
The Midwest, yeah.
Hello, America.
Yeah.
how as a child did that influence you coming into, rural America? What was it like when you got to Logan and your childhood with your family? And you talked about earlier before we came on the show, you speak multiple languages. And so how did that work going into rural Ohio in the late 70s?
English for my family was our fourth language. Kurdish is a language. We lived in Iran, so we spoke Farsi, Arabic. In Germany, we were exposed to German language and French. So, English was a thread throughout because of my parents' educational background. But coming to Logan, Ohio, I was as different as could be. I think there were only 2 other ethnic families in that whole community. The county had 25,000 as a population. I'm Catholic. I went to Catholic school. And I remember asking a lot of questions, and I ended up playing Mary in the Christmas pageant every year. And so I think that was, the nuns and the teachers' way of, you can ask questions, but maybe you want to hold some of those, and we'll get to them later. My mom used to put in special orders at the one local grocery store, things that were part of our diet, pita bread, things that are, part of the Mediterranean diet, like lentils or peas, even rice, weren't carried at the store. So we were different. I think we were good different, though. When people ask me, did you experience, sort of an identity crisis, I don't remember that. I think the faith community really embraced us and helped us with that immigration, application. And because it was a rural community and very much about everyone taking care of each other, the experience I had was overall very positive. Yeah.
So you have 2 sisters and
do.
an older brother.
Younger brother. I'm the oldest.
You're the oldest. Okay.
I am.
So as kids and as a unit, were you guys able to build off of each other coming into that type of community? And did you experience any type of prejudice or discrimination in coming into Logan, Ohio? Or it seems like the faith community really embraced you, but was there a major obstacle? A lot of the things we talk about on the show is obstacles. So as a child, what was, some of those obstacles as a family and between your siblings?
I think it came later. When the Iran-Iraq war started, and there was a lot of misunderstandings about, where we were from or what our background was, what our ethnicity was. I mean, I found myself, even as a 3rd grader, having to, grab a map and teach geography because most of the kids had no idea where these countries were or, what the different religion and language distribution was. They sort of thought about the Middle East as one entity where everyone was Islamic, everyone was Arabic, and I had to explain to them that, in the very place where I was born, there were at least 16 languages spoken and at least 6 religions in that one, community. And so I think people were comfortable asking questions, but I remember freshman dance. In 9th grade, we had a big freshman dance, and a boy who kind of had a crush on me, and he said, I really like you, but I couldn't possibly ask you to go to this dance. Yeah. And so, it kind of made me feel bad, but it's one of those memories where I look back on it and think, well, he had his family's beliefs, and he acknowledged me for whatever he saw was positive. So maybe I had an influence on what he thought, or, maybe as he got older, he looked back on, well, I knew this girl, and she was different. Yeah. But she was okay.
Okay. Yeah. Wow. So you told me a little bit about your parents and the uniqueness, of your family being, both your parents were educators. When they went to Ohio, did they continue to teach, or what, as within that family that sponsored you, what did they do when they first got there? Because I know that really had an effect on your work ethic, which I want to get to as well.
My dad went from being an educator to being an entrepreneur. My uncle was getting his business, his MBA at Ohio University. And the reason we landed in this rural Appalachian town was it was exactly halfway between where my uncle was in school and Columbus, which is the seat or the capital of Ohio. And so my dad shifted to becoming co-owners of a jewelry store and a clock and watch repair shop. The time we spent in Germany, my dad had quite an engineering, acumen. He learned how to become a watchmaker and a jeweler. So Saaty, my Kurdish maiden name, the history of my dad's line of grandfathers was they were all jewelers and clockmakers and watchmakers. And so he got that training sort of as a backup, but also because he was the eldest son. And my parents didn't grow up with a school system that let out for the summer. And so in the summers, my dad was sort of like, I don't know what this summer vacation stuff is, but you're going to work with me,
Yeah.
and
Sounds
I'm going to
familiar.
give you things to do. So in second grade, he said, you're really good at math. You're going to do inventory. Third grade, you're going to do payroll, because you have the strength to be able to learn this, and it's something that I need help with. So he would make, and I had to do things like clean, jewelry cases and other sort of, grunt work.
Yeah.
But he didn't differentiate. He sort of said, you're capable of this, step up. I'm going to give you this responsibility, and I expect you to do, at your level, the best job you can.
Yeah. So that work ethic from your dad early on, and one of the things I really appreciate about you is you're able to balance both the business and clinical, right?
Yeah.
You're a family physician, but you have an MBA, and so you're an entrepreneur, and so that facilitation between, the heart and also the business. How did you bring that together? Is it from your dad, or how did that stem?
I think my business competency comes from watching and learning, at my dad and my uncle's side. But I'm an artist.
Yeah.
Sometimes I don't know why I'm doing what I'm doing, other than I have this curiosity. And I'm a humanitarian, so I want to do something that matters. I want to be in a place where I leave things that are meaningful, in my career. So medicine came out of that curiosity, really loving anatomy and physiology, and doing, medical illustration led me to medical school. The practice and the health system and not understanding healthcare finance made me angry enough to go back and get a business degree because
Yeah.
I didn't want to sit in the room with someone telling me this is how and where the money flows.
Yeah.
For me, it was about impact and results. So I wanted to learn the business side to be able to be a decision maker.
Sure.
Yeah.
So that leads me to some of our relentless mentality questions. These are some of the questions we ask every guest to try to, vet out your mindset towards certain things. And, one of the first things I would ask along those lines, you brought up about being in the room. What is the major obstacle, doubt, or barrier have you encountered, after your childhood and becoming a physician? What has been the major barrier or obstacle that you felt in your career thus far?
I think I have to be honest about that. I think I come in this package, female, ethnic, a smaller stature. I tend to be underestimated and sort of sized up by, the cover.
Yeah.
It doesn't matter how many awards, it doesn't matter how many letters are after your name. As human beings, we have our biases inherently. And so I think when I, take something on or I walk into a room, I'm aware that that's in the room with me.
Sure.
The way that I've learned to manage it and sort of put context around it is I use it to my advantage when I can, especially to educate and to maybe change people's minds or to show them what I'm capable of. But it also motivates me to be extra prepared to, think about those that I'm in the room with and how they might think, what their backgrounds are, what's important to them, what their priorities are. And so I try to come into those spaces finding some commonality so that, this package that is or can be a barrier is less of a barrier.
So have you had, in a situation specific with, without getting into detail, but have you had an aha moment where you've been in a room like that and you've been able to change people's perception
based off of what you just said earlier?
You know, I think there are certain, board meetings that I've been a part of, especially when I joined early on, where I may have been the only woman in the room. I may have been the only, sort of young leader in the room of a different generation. And so, if I didn't know everybody or I hadn't had a history with everybody, I took the time to listen and wait to respond or speak or contribute something. And that's hard when you're passionate. I'm extremely passionate about my mission and what I put my energy into. Once I got to a point where I felt pretty clear about what everyone's agenda was or their priorities were, I would dig deep and contribute something that I thought would connect with at least a few people to change the direction of the conversation. And it's been really effective because I think people want to be acknowledged and heard. And I do think even people who are very set in their ways, when you present an idea that might be innovative or interesting and you've done your homework, they're usually willing to listen.
Sure. Yeah.
Yeah.
Okay. So at Adelante, you guys have really transformed not only healthcare in the rural community, but also have moved it more into the urban community as well. What advice would you give for physicians who are looking to move into administrative leadership, or even social entrepreneurs that are looking to get into healthcare, from what you've learned on growing these facilities from 12,000 to 70,000 patients a year? What would be the single piece of advice that you might give somebody into how they can make an impact as well?
I can only talk about what's worked for me.
Mm-hmm.
I think the minute that I got out of my own way and out of the box of the doctor's office is when I started to learn things that could innovate our health system. So learning from other industries. We often in healthcare, and certainly in the culture of physicians, we think we know it all. We think we're smarter. We think we've done the work. What was really impactful for me was learning from retail, hospitality, commercial, other types of service industries, and other individuals in the workforce that had a background that I'd never crossed over in. And so I would try to find those bridges and then use them as an entrepreneur to differentiate ourselves in the market. And so my advice is, you know what you know. Now take a look at what you don't know. Even if those threads aren't obvious, you may be able to draw some conclusions and leverage that to grow your business.
And I've seen that, and I know how passionate you are about art and design and how you've taken these concepts and placed them into your health center, which ultimately have a better effect on patient outcomes as well as looking outside of the box as well. So I think anybody that wants to learn more about what Avein is talking about needs to visit Adelante Healthcare and see their facilities and feel their facilities, because it is very different and unique in terms of how they deliver healthcare. So, okay, let's talk about inspiration. Okay. So I know some of this, but my question to you would be, what motivates you now, and who inspires you?
Everyone inspires me. I mean, my kids inspire me. The people I respect, my friends and colleagues, inspire me. I think nature is a place that I draw from right now. The arts, really, really important in my life. I think I lost that for a period of time because I sort of went deep into sort of corporate professional mode. There was a period of time I didn't paint for years. Yeah. And, when I started to paint again, what it taught me was you got to know who you are. What you do is important. Who you are is so much more connected to your success. Yeah. So
what motivates you today? So healthcare is a grind, right? We're both in the same industry. We deal with regulation. We deal with a complex environment that's always changing. We're a service business, so we have both patients and providers. So what motivates you every day to keep getting up and
keep growing. We'll talk a little bit about your future projects you have going on, but what gets you out of bed right now?
You know, I went through a pretty tough health challenge last year, and I feel like I've gotten a second chance. And I think that what gets me out of bed today is having that personal experience and knowing that health and well-being are about really the social determinants of health and addressing real life. You know, what is happening in people's lives. And I know I can make a great impact in that because for the most part, our health system is still about sick care in the doctor's office. Yeah.
Yeah.
And so I think that that's a lasting legacy that I can make a real impact in.
Well, let's talk about that. So I know you have a couple major projects going on. Do you want to tell us a little bit about your newest project in the West Valley, as well as some of the other things you guys are doing as well?
Sure. So, you know, I've done a lot in the service delivery side of healthcare as a community health center. What I know, especially coming from a rural community and having the connection to, you know, nature and the arts, in the West Valley, there isn't a lot for the community in terms of outdoor spaces and amenities. And there are kids in the West Valley who don't know where their food comes from, who've never seen, you know, fruits and vegetables growing. And so there's a coalition that I helped co-found called Wellspring Conservancy. And we were successful in getting 129 acres through the city of Goodyear, Parks and Rec, the flood control, Maricopa County. And what we'd like to do is to create a health and wellness innovation corridor and a community health park. I think far and above, you know, service delivery in a community health center environment, having that kind of a space, it's a third of the size of Central Park in New York City, will forever change, you know, the health status of that West Valley. I remember looking at a report on life expectancy and some of the zip codes in that area being easily a 20-year lifespan difference to Scottsdale or some of the more affluent areas in the county. It just hit my heart, and I thought, you know, as a healthcare professional, what are you doing about that?
You know, it's amazing to me because there's this healthy debate going on in our country about what to do in serving vulnerable populations, and both of our organizations share that passion for uplifting vulnerable populations out of poverty. And I think both you and I believe that if we can treat people's mind and body, we can get them to be back active in the workforce, you know, grow the wealth for their family, become homeowners, which then ultimately uplifts our community, and we all prosper from that. And I think what you're doing with Wellspring is an example of how we can't silo anymore, you know, individuals, and we need to look holistically at them. And so I commend you on that. I think it's amazing. I think the support behind that. You can follow Adelante Healthcare. Adelante Healthcare is www.adelantehealthcare.org.com. Adelante is a 501c3 nonprofit, so Charitable Contributions. Do you want to tell a little bit about that?
Yeah, the Adelante Shares program is an approved Arizona tax credit program. And we serve the entire lifespan from, you know, newborn to, I think our oldest patient is 104, which is
Very
really
cool.
exciting.
Yeah.
And lots of different ways that we impact the community, from, you know, healthy food boxes to our Reach Out and Read program. Lots of areas of social determinants. You know, we invite tax preparers in to help people with their finances.
Sure.
There's nothing that gets someone's blood pressure up more than being in financial trouble. So we want to address those root causes, and we try to do that.
Awesome. Well, thank you for being on. People can follow you. I know we talked about this earlier. You're on Instagram and you share your art. I know I see your art on there.
I do share my art. Lots of kitten pictures. My boys have kittens.
So you want to share your handle on Instagram?
It's Avein Saaty, Avein Saaty.
Awesome. Well, thank you for being on. Thank you for your story.
Thanks,
and thank you
Justin.
for your relentless pursuit and your relentless mentality. I mean, I really appreciate everything you do, Avein.
We'll plot together and keep doing this.
Yes. Thank you.
Thanks for watching. If you enjoyed what you saw today, please subscribe in the links below. And remember, never to quit, always be relentless.